Louise Wateridge is a senior communications officer and spokesperson for UNRWA. She joins us live from Zaweida in Gaza. Good to have you with us. So first of all, the UN has said its aid operations have had to be stood down amid the high number of evacuation orders. Where do they stand at this point?
Yeah, so the last 48 hours, once again, has been completely unprecedented in terms of a humanitarian response. The area you're referring to, there were evacuation orders in Deir al-Balah. We have UN headquarters there, we have UN offices, UN accommodations. Given these very dangerous orders and the imposing military operations, staff had to leave this area. They were forced to flee this area, just as populations are forced to flee this area. And while they do this and while they reconfigure operations, this does cause a pause in the response we're able to provide to the population. But one thing we need to be clear is that the UN is here. The United Nations is present in Gaza. The operations have not stopped by any capacity. We continue to do everything we can. But as I said, this is a completely unprecedented situation here. Every day there are new rules, there are new challenges that we have to find a way to work around. And we will continue doing so to serve the population and to serve the people in Gaza who need us.
But Louise, while you are being forced to pause, where does that leave people's humanitarian needs, food, water, even their need for medical attention when hospitals have to be evacuated too, and medical staff?
Yeah, I mean, people here need everything. They have needed everything for the last 10 months. It is nothing short of a struggle to provide what people need here because we don't have enough aid. We don't have enough supplies coming in. We don't have enough access to distribute to people. And as you say, when these displacement orders are issued, the first thing the hospitals and health facilities have to do is take care of their patients, take care of their staff. You know, they have to relocate patients to safety, move medicine, and all of that delays us providing services to the community. This is the challenge we have faced for the last 10 months. We keep reinventing the response. We've had health centers completely destroyed. We've had health centers damaged. We've had health centers in these evacuation areas, and we are opening new ones in other areas. We are opening mobile medical points. Our doctors and nurses are even going tent to tent and offering services. We're just doing everything we can to make sure the population has what they need. But there's only so much we can do if we do not have enough supplies, if we do not have enough medicine. I heard in your earlier report, doctors saying, you know, they can do what they can, but patients are then dying of sepsis. There are so many people dying in Gaza from things that can be treated. People can be saved, but we do not have the means to do this for them. We do not have the means to operate to our best ability.
We also understood there's been an announcement by the UN that they've had to also pause vaccinations. How worried are you about a rapid, even more rapid rise in spread of disease as a result of that?
We have had the first confirmed case of polio in 25 years in the Gaza Strip this week in a 10-month-old baby. We are doing everything we can. The World Health Organization, UNICEF and UNRWA are working with partners to start this vaccination campaign as soon as possible. We are expecting this to start in the coming days. It's for 640,000 children under the age of 10. We need a humanitarian pause for this to happen. We cannot vaccinate children under a sky full of bombs and strikes. We cannot vaccinate children who are being forced to flee, who are running for their lives, who are running, you know, with or without family. 17,000 children are estimated to be separated or alone in the Gaza Strip. We need better situation for the population, for the humanitarians to work under. We need humanity here. We are severely lacking humanity for people in Gaza. They deserve to have vaccines. These children deserve to be vaccinated against polio. They deserve to have water. They deserve to have food. There's so many basic rights that they do not have here, and they need them now.
Right. Well, Louise, we understand that looking at the number of evacuation orders this month, I think the highest since the war began, only something like 11% of Gaza is not under evacuation orders. And a lot of people now running out of land they can go to are camping out by the sea, on the beach. What does that mean for your operations going forward?
Yeah, we had someone say this week, the only place left for us to go is the sea. you cannot see the ground. If you look in Deir al-Balah, if you look in Khan Yunis, you cannot even see the sand anymore. There's so many people confined to one space. It's desperate. And this also means the humanitarian area we're able to function in, the humanitarian operations are shrinking too. It's nothing short of a challenge. But as I said, you know, UNRWA, we have staff here who are part of this displaced community. They are going to work every day. They are doing everything they can to serve their communities, to do whatever they can for their children, their families. They're determined to keep operating as long as possible. And that's all we can do. We need better circumstances. We need better access. We need more supplies. But we will continue to do everything we can here on the ground.
Thank you so much for sharing your perspective. Louise Wateridge there, Senior Communications Officer with UNRWA.